Hey everyone, it's Liam here from Physiotherapy, and today we'll be continuing our running vlog series and talking about a couple of the common myths that are out there about running. So let's get into it. The first myth that we're going to talk about is that we should always avoid knee valgus. Now, knee valgus occurs when our knees travel inwards towards the middle of our body. And this might happen during any kind of weight-bearing activity, so like running, jumping, going upstairs. And initially this idea was perpetuated because there was some evidence that showed this is a position that people often injure their knees in. However, more and more research has shown that this position is actually necessary in a lot of sports and it's a necessary response to ground reaction forces, and sometimes this will just happen. So instead of trying to avoid it completely, it might be more valuable to try to just make sure you're in control of your movements. The next myth that we'll talk about is going to be that you should always be foam rolling before and after running. Now, this myth is very common, and we often see people spending lots of time on foam rolling. But the research doesn't really support the benefits of foam rolling all that much. So what the research shows is that foam rolling can help to decrease some muscle soreness, and it can also have some short-lived changes to help us perform a little bit better with explosive movements like sprints, as well as improve our range of motion or the flexibility of our muscles a little bit. But again, these benefits are short-lived and they're pretty minimal. So foam rolling is a great tool to use, but again, it shouldn't be the majority of our warm-up or the time that we spend warming up or cooling down. Next, we'll move on to training intensity. Now, a lot of people feel that we should be training hard every single time that we exercise. But again, the research does not support this. So what research shows is that we should actually be training at a low intensity most of the time. So there's this 80-20 rule that basically states 80% of the time we should be training at a low intensity and only 20% of the time we should be training at a high intensity. This will not only help decrease our risk of injury, but it will also help improve our performance even more than if we trained at a high intensity for more time. Next, we'll move on to the idea that you should always be stretching before and after your workouts. When people think about this, they typically think about static stretching. And static stretching is when you're basically going into a stretch and holding that position for a prolonged period of time. What the research has shown is that stretching really only leads to about a 4% decrease in injury risk, versus something else like strength training leads to a much higher decrease in risk, so around 69% decrease in risk of injury. Furthermore, static stretching has been shown to decrease power output immediately after it's done, and more so with longer holds, so holds over 60 seconds, we'll say. Research tells us that a more beneficial approach would be to do dynamic stretching, in which case instead of holding one position, we'll go into a stretch and move out of a stretch repeatedly. So doing something like high knees for a warm-up will give you a bit of a stretch, but then you'll come out of it. So it's an active, moving stretch as opposed to just a passive one where you sit there and hold it. And that has been shown to have more benefits. The next myth that we'll talk about is going to be that running causes arthritis. Now again, research does not support this, and with the current state of the research, we can't really determine exactly what the relationship is between running and arthritis. But there is some research that shows that athletes who are very competitive runners are at an increased risk of having arthritis compared to recreational runners. Research also shows that people who are not runners at all, so people who are more sedentary, also have an increased risk. So it creates this spectrum where those on either ends of the extreme of exercise are at an increased risk. So if you exercise a lot or you run a lot, for example, competitive runners, or if you don't exercise at all, those are the groups that are at increased risk, versus the recreational runners are kind of in the middle and they have the least risk of developing arthritis. Even with this research, we still can't make a causative determination. So we can't say that it will cause it, but we can say that there is that association. Furthermore, we know that exercise is beneficial for arthritis. And so if you're deciding whether or not you should run, the chances are running is going to be beneficial for you as long as you're not overdoing it. The last myth that we'll talk about is that you should run every day. Now, a lot of people feel to get better at running, you need to do it every single day, regardless of how you're feeling. But Again, this can be dangerous because it can lead to overtraining. Our body needs some time to recover, and our recovery is just as important as our training. So if you do feel like you want to get more activity in, a great option is to do cross training instead, where you're continuing to exercise, but you might do something a little bit different, like cycling or swimming, something that's not running in between, so that way you have a break and you get adequate rest. That's all we're going to be talking about today. Thanks for joining us, guys. Be sure to leave a comment and let us know what you think or if you have any questions, and we'll see you next time.